MyoSlide, a universal whole body exercise device. What it can do is it's basically a moving platform which has a wide range of exercises. So let us help you increase your flexibility, increase your strength, and increase your endurance.
Congratulations on purchasing the MyoSlide. Hi, I'm Dr. Gavin Hamer, physical therapist, and really what I wanted to show you is what this can do, which is really designed for hip, core, and lower leg exercise, whether it be for before a total hip, after a total hip, bursitis in the hip, patellofemoral knee problems, or just core. It is so versatile, and you'll find it incredibly adaptable, and I wish you well and have fun with it. Take care. I wanted to introduce you to the MyoSlide. So there's a lot of components to it. The basic is the stationary platform, a moving platform, and an adjustable platform. In addition to that, we have a foot plate which goes in here, and then the main components of it are the resistance bands, which come on into here. It's easy to put them on there, and then you have access. And of course, we can do it both sides. And now we have resistance going that way, either with your arms, with your legs, with your body. In addition to that, you have a non-slip pad, which goes underneath on the floor. And that is the full package. Non-slip pad, various resistance bands, the adjustable platform, moving platform, stationary platform, and foot plate.
So here we are with that 45 inches long, 11 inches wide, and approximately 20 pounds. And of course, we can use it at home. It's designed also, it would be great for home care. Physical therapists bringing it into your house to help you with your pre and post total knee or total hip surgery rehabilitation. It is sturdy enough to be used in a commercial gym, particularly if you want to do hockey training and such. Of course, in a nursing home, again, for hip and lower leg strength, any rehabilitation, balance, and so on. And we use it currently in a physical therapy outpatient clinic, and I would say it's used basically all the time. So it's a pretty versatile piece of equipment. It's designed to accommodate a wide range of strengths and balance abilities. So as with any moving platform, you must make sure that you are able to safely perform the exercise without the risk of falling. And this may be either hanging on to a handle in the bathroom, a kitchen bench, a wall, a chair, or a balance frame. So there's different positions. You can actually use it lying down where you're pushing your leg out. In sitting, there are various exercises, and there are a lot in standing, but also you can place it on a table and use it for using the upper extremity, your arm and shoulder. So rule one is always, you should always have at least 2 resistance bands on. Occasionally they do break, and this is not a surprise, but you want to make sure that if one breaks, there's still one to give you some resistance. Otherwise, you may find the moving platform moves out a little bit quicker than you wanted. It may be easy to change the bands up on a table, or tip the MyoSlide up on its end so you have better access to it, so you don't have to bend over to the floor. There's certainly no problem to put it on the floor, but it just saves you bending as much. So when first mounting or getting on it, you must stand on the stationary platform first. Now you're steady, you're hanging onto the chair or whatever balance assistance you require, and then you're going to put your second foot on either the adjustable, on the moving platform. So then that will move. So you're always going to go into the blue one first, whether that be the adjustable platform or the stationary. They aren't going to move, and then you can hop onto the moving platform. Likewise, when you are getting off and dismounting, you must get off the black one first, which is the moving platform, and then you will be stable to get off the non-moving one, whether that be the adjustable one or the stationary. So in the standing position, make sure you're holding onto something firm that can give you balance and stability. For example, as we've said, a kitchen bench, the back of a dining room chair, a wall, an S3 balance frame. And don't use it in standing if your balance is insufficient to be able to handle that.
All right, so the normal setup is you got a non-slip pad on the floor, the handle, there's wheels that allow this to come on down, and then you're just going to place it on that, which means really it will not slide. For safety reasons, you're going to stand on the stationary pad first. We have the resistance bands that we want. Now we're on here, slightly bent, and then you're just pushing out to what you want, the reps you want. So that would be pushing out abduction. However, we have the option also to put this anywhere we want. Once you put your weight on, it stays stationary, and now we can come in here like this for adduction.
As you can see, there are many options. So now let's look at the standing exercises. Some of these are applicable for a total hip, and other ones are more advanced. The total hip ones will have a logo down on the left-hand side. So here is the list, which we can review, and also gives you the movement of the hip. Hip abduction is pushing out to the side, and which muscle is involved. So first of all, to get our hip abductors, which is a common weakness either with knee pain, total knees, total hips, obviously, and is an important group to exercise, and is one of the main reasons the MyoSlide was developed, because it is probably the most effective way of getting the side muscles of the hip abductors, glute medius, working.
So slightly bent, you're going to push out to the side, a lot of weight on this leg, pushing out here. You're going to do this if you don't have any balance problems. This is the leg doing most of the work for your side hip muscles.
So you can see in this case, the right leg is the stationary leg, the knees are slightly bent, and we know from EMG studies that the hip abductors on the right are actually working harder than the leg on the left. There's some glute involvement depending on how bent or flexed the hips are, and obviously some quadriceps for the knee as well. So now what we are going to do is we're using the chair for balance. You're going to stand up on the stationary platform first, and then push on out.
So we're going to push out to the side, and we need to make sure we're standing with most of the weight on this leg here, and then with knees slightly bent, pushing to the side. Hanging onto the chair or whatever you need for balance.
Those green bands are 6 pounds resistance, so there's 12 pounds of resistance on there. And with the selection of bands you have, there is an infinite number of combinations to give you the strength that you require. So now when we bend down lower, it's going to create more load on your gluteus maximus, because you're more than 40 degrees flexed. So now this is going to work your hip abductors on the right, your glute max on both the left and right, with your quads also. So it's a very comprehensive exercise.
So we're coming down a little lower, so there's more glutes involved, and then there's going to be rotation of the hip, with our medial rotators. So then we're low, pushing out here like that. The more quads, the more buttock, the more rotators of the hip.
So now we are trying to pull in, so you can see how we're on the adjustable platform, and we would stand on that first because it's blue, and then we're going to pull the black moving platform towards, and this is going to get the hip adductors working, which is the groin muscles, which are the groin muscles.
To use the chair for balance, we're going to hang on to that. We're standing on the adjustable platform, and we're going to pull this in, which is getting the inside groin muscles working.
So now we are doing it without the chair, so this is a little bit more advanced.
So we want to strengthen the groin muscles, the adductors, so we're crouching down a little and pulling the movement platform in. This is the adjustable platform. We can have that wider if we want it there. Come on in. Once the weight's on, it won't move.
So now we are getting more glutes, glute maximus kicking in because we are flexing more. Still pulling in, getting the adductors. So we have hip adductors, hip extenders, and this is going to get the lateral rotators. So as that right ankle comes in, the lateral rotators or external rotators of the right hip are going to be working. And to a certain extent, the rotators on the left are going to be working as well. So this is a great exercise for, again, knee pain and hip pain.
So we want to strengthen the groin, and here we have the adjustable platform, and then crouching down low means that we're going to use our lateral rotators of the hip on this side, holding on in. So it's quads, the glutes working in the back, and then the side glutes working in there with the rotation.
Of course, we all need hip extension strength. Conventionally, we have done bridging, leg press, and such. So we're going to use the chair here for balance. So we can do different degrees of balance requirements. So you'll notice the right foot is standing on the floor, which means that the person's going to be incredibly stable. This would be good for a total hip. And then the moving foot, the left, is on the moving platform. And with the grip mat, the MyoSlide isn't going to slide. Depending on the floor that you're on. If you're on carpet, it may not be as effective. But if you have a problem with that, there's no reason why you can't rest the other end, the handle end, up against the wall and it won't move. So in this case, this is the most stable position. The right foot is on the floor, you're hanging onto the chair and pushing back.
So we're doing hip extension on this left leg. My foot, my stapling foot is high up on the floor, so I have good balance hanging onto the chair, and then the moving leg is on the movement platform, pushing back.
This is using the quads pretty heavily on the right and your hip extenders on the left. So now coming in with a slightly less stable position, the right foot is up on the platform, on the outside of the platform, and just requires a little bit more balance. So with you're standing on the platform, so there's a little bit more balance required than on the floor. So you're here, still hanging onto the chair, standing on the wide part, and then the moving leg is on the moving platform. Weight is on through here and there, pushing back for hip extension. The third position, which is the most advanced, is where the person does not have a chair to rest. They're standing on the platform, and this requires quite good balance to perform it this way.
If your balance is good enough, you're going to stand on the wide part here, and then on the moving platform, coming in and then pushing back, hip controlling really with the right hip working here and your hip extenders on the left.
So now we can do a push forward maneuver, which is basically a little bit of quads, but mainly hip flexors. So in this case, for stability, again, we're holding onto the chair. The stationary foot is on the outside of the stationary platform, while the moving foot is on the moving platform going forward, eliciting hip flexion and knee extension.
So we want hip flexion and knee extension, hanging onto the slide or on the outside here, pushing in, pushing through, legs straight.
So we can use this also to pull back. So in this case, you're pulling back, which means that the hamstrings are working mainly, as against the pushback where it's the glute max. So in this case, you're standing on the adjustable platform, and then with the heel hooked over the moving platform, pulling it back.
So I want the hamstrings to work. We're going to stand on the adjustable platform, which is stationary. We have a chair placed here for balance, and then you're reaching out here and pulling back. So now this is your right hamstring working with this hip stabilizer. Take the black foot off first, and then there.
So that concludes the standing exercises, although we will add some more in upcoming videos, but this is the base set. So now let's get on to the sitting exercises. So with sitting, there's not as much weight on the MyoSlide. We can do it two ways. One is it comes with a grip pad, and that seems to work very well on firm surfaces. The alternative is to put it up against the wall, and in this case, you can see the adjustable platform has been taken off just to give a little bit of a spacer to put the MyoSlide in the correct position. So our options are push out, which involves knee extension and quadriceps, pull backs, which is hooking and pulling the heel behind, flexing the knee, and then your hip extenders, external rotators, and internal rotation of the hip, all done in sitting. It comes with a push plate, which just gives you a little bit more purchase. What you're going to find with stroke patients, they may have trouble holding their foot correctly, and it will slip off without the foot plate. Otherwise, if they can hold their foot up, as in bring their toes towards their nose, the bar on the moving platform is sufficient normally, but this gives you an extra option.
So we want to do quads push out, sitting on the edge of the chair, and then we're just going through there, trying to make sure that we're getting right to the end, and pushing out. It's going to be hip extension and your quads working.
Now moving on to hamstrings, so you can see how the foot is hooked over the bar at the end of the moving platform and pulling back. But you also have the option, if it moves on the floor surface that you have in the grip mat, you can also put it up against the wall.
We want hamstrings to work. Now they're sitting on the edge of the chair, holding on in.
So now we're into rotations on the hip. So you're in sitting and the hip is at 90 degrees. The idea is that the femur or the thigh should be straight out, and you'll see me putting my hand on the knee to make sure that it's rotation of the thigh occurring and not the knee going across the body or out to the side. So hip external rotation is important, using the small muscles and the big muscles of the hip. And this.
I want the rotators of the hip to work, particularly ones which are rotating out. So we sit a little bit down, we're on an angle, keep the knee from moving, hold it there, and then there we are, there's the rotation of the hip, outward rotation.
Notice, although the foot is going in, the thigh is rotating out. So then the opposite would be internal rotation or medial rotation. With total hip patients, particularly if you have a posterior approach, you may not want to do this exercise because it involves the hip at 90 degrees and going into medial rotation, which is a position you don't want to be in the early stages, in particular after a posterior total hip.
We want to rotate the hip, so we're sitting a little bit further down, so we're on an angle to start with as far as the lower leg is concerned, and then keeping the femur or keeping the knee pretty well straight there. There's rotation of the hip, internal rotation of the hip.
Now we're moving into the upper body, into the shoulder, arms, and core. We can do it two ways depending on the table surface. It won't move very easily if you have the grip pad on. In this case, we're using the wall. So we can push out using both hands or singly, left or right. And then we can pull back, obviously using both hands or the left or right. And then doing side motions, pushing out across the body or pulling in across the body. As you can see, we can get elbow extension working quite well. There's some finger exercises and the shoulder. So pushing out, this is both hands.
So we're pushing out, which is going to engage the abdominals, coming out with the shoulder stabilizers. And coming back.
This, of course, could be modified to being on the floor and kneeling or doing a full plank. So this is with the single left shoulder, pushing on out.
So we are going to have shoulder press, flexion, pushing on out, and back in. Core work as well, shoulder stability.
You can make this more core by not having the arm move as much, so the trunk does more, or keep the trunk still and move the arm more. So now we're going to pull back, and this involves finger flexion strength as well.
So we're going to do double pull back, so pull ends to here.
So again, single pull ends or pull backs.
So shoulder extension, you can put the towel on for comfort, hooking in here, and then just pulling back.
So shoulder push out with abduction, lateral rotation is going to be an important exercise for most people with shoulder instabilities and post rotator cuff repairs, depending on what stage they're at. This is an excellent exercise.
So what we want to do is we're going to shoulder abduct with this right arm with a little bit of rotation. Obviously we're going to put the towel here for comfort. We're here, and then we're just pushing on out. A little bit of weight, so you could actually transfer, put more weight on it here, and push out if you wanted.
So the opposite of that, of course, is pulling across, getting your pecs working, your adductors, subscapularis, and so on.
We're going to do across the body adduction of the left shoulder, towel on here for comfort, just pulling on in. Using the wall as a stopper. You could obviously put some foam or something there if you're worried about the wall getting marked.
So there we have it. MyoSlide is owned by Dynamic Exercise Equipment. Here is our phone number and also an email. Dynamic Exercise Equipment is set up to create and develop innovative exercise tools for the general population and physical therapy. So hopefully you will enjoy your MyoSlide, and if you have any further questions, feel free to contact me. This is Dr. Gavin Hamer, wishing you well.